Hey, what's up, everybody? This is John Logan here again with DD214 Drip. Let's talk about it. But before we do, I would like everybody to please thank you so much for hitting that follow and subscribe button. Follow and subscribe. Thank you all so much. I need you for this. Thank you. I can't do this without you. So thank you so much in advance for following and subscribing to my channel. So, veterans, let's talk about something that can seriously impact your VA disability claim, the C&P exam. Yes, let's talk about it. The C&P exam. So, a lot of veterans walk into the exam trying to be like they're still in the Army, trying to be tough, or like they're in the service, Air Force, Navy, the Marines, Coast Guard, Space Force. They'll walk in trying to be tough, saying things like, I'm good, I'm fine, it's not that bad, oh, it only hurts a little bit. But here's the problem: the C&P exam is not the time to downplay what you're dealing with. It's not the time, veterans, to downplay your condition. This exam is here to help the veteran understand what the condition is, how severe it is, how it affects your work, your family life, your sleep, your mobility, and your day to day routine. So, today we're going to talk about what to say and what not to minimize or downplay, and why veterans need to explain their worst days honestly and truthfully. All right, let's get into this. The C&P exam is not a regular doctor's visit. That's what we need to understand. This is part of the VA claims process. You are not there to impress the examiner. You are not there to prove how tough you are. You are there to give a clear, honest picture of your condition and how it affects your life. The VA may request a C&P exam when it needs more information to decide your claim. They may not always ask for that, but when they do, you need to take that very seriously and make sure that you attend that exam. That exam will help evaluate the severity of your disability and help decide the correct rating. So, talking point number one: veterans, be honest, not tough. A lot of veterans have been trained to push through the pain, keep moving. That mindset may have helped in the military, but it will definitely hurt you at a C&P exam. Don't say I'm fine if you're not fine. Don't say it only hurts sometime and it affects you if it affects you several days a week. Do not say I can manage if your take on managing is taking medicine every day, or missing work, or avoiding family functions, or pushing through severe symptoms. What you should say should be truthful and honest. Here's a clear example. If you're having back pain, my back pain is present most days. On bad days, I have trouble bending, standing too long, or sitting too long, or I have trouble sleeping through the night. That's better than saying, my back just hurts. You have to give a clear picture. Okay, talking point number two: explain your worst days, veterans. Explain your worst days. This does not mean exaggerate. It means do not only describe how you feel on your best day. If your symptoms come and go, explain the frequency, the severity, and the duration. Use this simple format. How often does it happen? How bad does it get? How long does it last? And what does it stop you from doing? That is critical. What does it stop you from doing? An example: if you're having migraines or you're having headaches, and I will be doing another segment on how to track these. But if you're having headaches or migraines, you can say something as simple as this: my migraines happens 3 to 4 times a month. When they hit, I have to lie down, and I have to lie down in a dark room. I get nauseous. I get sensitivity to light. I may lose several hours, or I may not even sleep at all. That right there gives a clearer picture than just saying, "Well, I get headaches. I just get headaches sometimes. I don't get them all the time." So Can y'all see the difference in that? That brings us to talking point number three. Talk about functional impact. Talk about functional impact. So the VA is not just looking at the name of the condition, they want to understand how it affects your ability to function on a day to day basis. E- Explain how the condition affects work, sleep, walking, standing, lifting, driving, your relationships, your concentration, your mood, your personal care, household chores, and most of all, your social activities. So, an example of this could be something like this: my knee condition affects my job because I can't climb stairs or ladders like I used to in the past. I have to take breaks, I have to avoid kneeling, and I struggle after standing for long periods of time. Can you understand? Can y'all see the difference in just saying, well, you know, I could do things, or I can't, I can do some things. You- So you see how explaining it in a little bit more detail can help that examiner um, give you a proper exam, which can help that rater later on give you a better rating. Talking point number four: do not guess or perform. I say that again: do not guess or perform. If the examiner asks you to move, bend, raise your arm, or describe the pain, be honest. Do not push past the pain just to be polite. That's critical, veterans. You should always stop at your pain point. Do not push past it. I don't care if it's just a little bit. Do not push past it. If it hurts, say when it's hurting. If you can't move past a certain point without pain, you stop there. Do not force yourself through motions because you want to look good or you don't want to look weak. So let's say this: that is where the pain starts, or I can't go further, but I can't go further without any pain, or if I push beyond this point, it's usually pain that comes later. So y'all see how those differences, that's a very big difference on how to explain your condition. Okay, talking point number five, and this is a big one for us veterans. Bring notes. I'm quite sure that's something that a lot of us don't do, but taking notes on a day-to-day basis and bringing those to your CNP exam can be the deal breaker. Veterans can get nervous and forget things during a CNP exam. Bring short notes to remind yourself of your symptoms, your medication, your flare ups, your limitations, and how your conditions affect your life on a day to day basis. Do not read a script like you're performing. Just bring your notes or use your notes so you don't forget anything. And don't forget the most important factors. Your notes can include current symptoms, how often those symptoms happen, medication, treatment history, flare-ups, missed work, sleep problems, physical limits, mental health impact, and important dates or events. Talking point number six: know what the examiner does and do not do. The examiner is not the final decision maker. The examiner collects medical information and may give a medical opinion. The VA claims processor or reviewer makes the decision based on your full record that includes service records, medical records, lay statements, DBQs, and the CMP exam. So you see how your final rating is inclusive of all of those things. So do not argue with the examiner about your rating. Focus solely and clearly on explaining your symptoms and how those symptoms limit you on a day to day basis. Talking point number seven: after the exam, write down what happened. Again, this is going back to those notes. Write down what happened. As soon as you leave the exam, write down what happened while it's fresh on your mind. These are the things that you write down: the date and time, the name of the examiner, what was discussed, what tests were done, how long the exam lasted, whether the examiner listened, anything important that you think was missed, and anything you felt that was inaccurate. This can help you later if your claim is denied or if you rate it lower than what you expected. And if you need to, and if you just need to challenge something that's inaccurate. Uh, what the veteran should not do is don't exaggerate, don't lie, don't minimize, don't go in there acting like you're tough, don't say you're fine out of habit. Do not push through any pain or range of motion testing. Do not skip the exam. Do not go in unprepared. That's another one, veterans. Do not go in there unprepared. Do not assume the examiner has read everything in your file. Do not leave without making sure you explained your main symptoms. All right. Now, here's the DD214 News Drip Veteran Truth. The truth is, a lot of veterans lose rating percentage because they minimize what they're going through when they go into the CNP exam. They walk in on a decent day and talk like that they have a decent day every day. But the VA needs to clearly understand the full picture, especially your bad days, your flare ups, and your functional limitations. Again, the VA clearly needs to understand your bad days, your flare ups, and functional limitations. This is not about gaming the system. This is simply about telling the truth without watering it down. And there you have it, guys. This is your DD214 News Drip about the CMP exam and how not to minimize it. Thank you all for tuning in. I hope this is helpful for somebody. Um, Again, thank you all again, and I hope that you all will please again, once again, follow and subscribe, follow and subscribe. Also, would y'all please follow or go onto my website, dd214drip.com, dd214drip.com. This is where I sell my t-shirts, and this just helps me bring more content to you all. I think you all may like some of those shirts, so just check it out, dd214drip.com, and just check out some of my products. Thank you all, guys. Thank you all so much, and thank you for your service. Um, I'm a veteran as well, so I really appreciate everybody, and I appreciate and love everybody that I serve with. Again, this is DD214 News Drip out.